Kosuanati era one radio empenyini say. Yensuma na motenten yesuma benyasafo era one radio yedin sem anumwaye ebre.
They are four women. They are beautiful with brains. They are eloquent, decent, wise, and experienced. You have heard many, the funny. Now, it's time to hear the experience and the brainy. Meet Selena, Dorcas, Gifty, and Annette as they present the real in common getting. In common biaye sesi chain, a dead, as in takrenu assume the dead. The real in common getting. Showing live this and every Sunday, 7 p.m. on Era One Radio on Facebook and on YouTube, Era One Radio and our Taibo channel. Kaise, so we see the real in common getting ya. What brabon tete, we nyan konkonsa, we the real in common getting.
Hello, beautiful people of Ghana. This is Banahine Specialist Hospital. We are so excited to announce to our people Ghana that we are finally opened and we are accepting patients. At Banahine Specialist Hospital, our extraordinary physicians and nurses are here to provide a high quality medical service to our extraordinary patients. Our services include primary care services, maternal, neonatal, and pediatric services. We also have an in-house pharmacy. We have x-ray and laboratory services available to you. Come to us for all your healthcare needs and you will be happy you did because we believe the health is wealth. Thank you and stay blessed.
All right. Good evening, Era One Radio listeners. I want to welcome you to our broadcast this evening. The program is Health is Wealth. Protect it. If you have good health, you have good wealth. And so you have to protect your wealth. Make sure you are eating right, exercising so that your health will take you further. I know your doctor says if you eat vegetables and exercise, you will reach the 70 years that God gave us. And if you combine that to a very good lifestyle, you get your 80. So on Era One Radio, our maxim is that exercise, eat good, and you will live longer. All right, tonight we are coming your way again on Era One Radio. We are broadcasting live on Facebook and YouTube, and then also on Modern Ghana Radio. Tonight I'm broadcasting from all the way from Arizona. So be with me, be my guest, and contribute, listen, and make a contribution. All right, tonight we're talking about knowing your rights and responsibilities as a patient or a healthcare recipient. The number to call is the same, 240-280-2633. And if you want to text us, it's 510-931-0946. And before I continue, I know I'm expecting my co-presenter, Dr. Opoku Agyeman. And before I start, on behalf of Era One and all of us, I want to wish the people of Ukraine our sympathy. What is going on is tragic. It's painful. It could happen to any nation. And so we are sympathizing with them that God will lift the hand of what is going on and there shall be peace. Peace shall be restored unto Ukraine. Of course, already I know about 120 people have evacuated the country, which is sad. So we are praying that it shall be well with them. All right. I think Dr. Opoku is in the studio. And we're talking about your rights and responsibilities as a patient, whether you're going through a health professional or wherever you're having your medical treatment, you have your responsibility. You also have a right. Some people say, oh, anything goes. No, it's not everything that goes. You have a right to determine the kind of treatment you're getting from your provider. If he tells you, I'm going to amputate your arm, and you think that is not the right time or you want to hold on, you have your right. Although there might be some repercussion, but then you don't take anything that your provider or doctor tells you to do. So that is what we're going to discuss tonight. Of course, February is being set aside as the month of children's dental health care. We did that last week. And it's also heart health. In addition to that, there's so many things that we want to discuss on this show. But tonight, like I said earlier, I want to look at you as a patient. What are your rights and your responsibilities? Their responsibilities. Your responsibility. So you'll be yeah, require so Dr. Shewa, Dr. Boss, oh, sister girl, see me chow na back. Yeah, why also Dr. Cosnature, me na kasa me here. There be Ushina say in due time say chow unaya, which make us a doctor and so oh, see, I'm person me chow now say train kakana, Dr. Nekas, oh, see, and train to see a be diabetic, who bet me a war, then more agree. All right, Dr. Opoku Agyeman, you want to say something before we roll in? I know he's going to be the moderator, or actually it's going to be a discussion between the two of us. We're going to discuss this issue. Maybe I will start and he's chipping with questions. So, Dr. Ernest, any introduction you want to give us?
Boison. Today we have a very important issue to discuss with people in this country, particularly foreigners from our own home country. The problem with patients' rights is something which is very important. Everybody needs to know it. You have to know it when you are in the hospital. You have to know it when you are in your physician office. And if you have to know it when you are admitted, so that anything that they are doing to you, you know what the precaution is going to be. You have to know all the side effects of all the medications that they give you. Anything, you have a question to say why. Or give me some meaning of what you are doing, or the procedure that we're doing. Tell me how you're going to do it, how long is it going to take, what are some of the things that are going to happen to me afterwards. All these things come to play if you go to the hospital and you don't ask. If you don't ask, you will know it. And when you don't know it, when you come home, something happens, you cannot go there and tell them that you did this and this thing happened to me. Because before anything is done to you in the hospital, after the doctors or the secretaries have explained everything to you, the last thing to do is to sign something. You sign a consent, and the consent has a whole lot of things in them. You need to understand the consent very well before you sign anything. Else, if you sign the consent and anything happens to you, you don't have to blame them. You have to blame yourself. So that is what me and Dr. Boison is going to discuss today. We want everybody to pay attention to everything that we say here. If you have any question, please don't hesitate to ask us, because we are ready to answer your questions. And the question that we are going to answer you is going to benefit you. If not today, it's going to be tomorrow. So, Dr. Boison, let's ride the paddle.
All right. Thank you very much, Dr. Opoku Agyeman. Let me begin with a little bit of commercial to applaud our women, and then we'll zoom into our discussion.
They are four women. They are beautiful with brains. They are eloquent, decent, wise, and experienced. You have heard many, the funny. Now, it's time to hear the experience and the brainy. Meet Selena, Dorcas, Gifty, and Annette as they present the real in common getting. In common BISS chain, a dead, as in Takrenu assume the dead, the real in common getting. Showing live this and every Sunday, 7 p.m. on Era One Radio on Facebook and on YouTube, Era One Radio and on Taibo channel. Kaise, so we see the real in common getting what brabon tete, we nyan konkonsa, we the real in common getting.
You the real in common kitty. Make a date with them tomorrow evening, 7 p.m. Eastern, and you will love their discussion.
Actually, I really love the advert. So enticing.
And it's so professionally made, very professionally made, All right, thank you, listener. We are going to zoom into our topic. Today, we are looking at the rights and responsibilities of a patient. You as a patient, what are your rights? You deserve some rights. You have your rights. It is not everything that goes. Don't like I said earlier, we don't just say, oh, anything you want to do for me, that's fine. You have a right. You have the right to say no or yes to anything. Of course, some of them have come with their own repercussion. If your doctor tells you something and you say no, they know why they're saying it, so that could go against you. But that doesn't mean that you just go and sit and say, doctor, and the opposite may be familiar. That is not the case. So we are looking at that topic today. All right. Again, if you just join us, you are on Era One Radio. We are broadcasting live on Facebook and YouTube and Modern Ghana Radio. If you want to call us and be a part of this discussion, The number to call is 240-280-2633, and you can text to 510-931-0946. All right, so we are looking at the rights and responsibilities, what the doctors have to do, or providers, nurses, whoever is taking care of you, and what you have to do as a patient. Once you enter that medium where you are being taken care of, you become somehow a patient that the doctor has to take care of you. All right, so let's start by looking at the Code of Medical Ethics Opinion 1.1.3, which says, and I read, the health and well-being of patients depends on the collaborative effort between patient and physician in a mutually respectful alliance. Patients contribute to this alliance when they fulfill responsibilities they have to seek care and to be candid with their physicians. When it comes to healthcare, the wordings are so very well crafted, because in healthcare, anybody at all can be sued. So they are very particular about what they do and what they say. So these words are properly and carefully crafted to make sure that it works very well. So they use the word mutually, which means it's not just only one person, it's not just the provider or just you. The two of you working in tandem, in sync, to make sure your healthcare is optimal. So you have your portion to play, and the doctors have their portion to play. The first one I want to tackle is, it's your right to know that your physician has up-to-date medical information on which to base your care. What that means is, your doctor is not going to go by a storybook he read or a medical diagnosis he read years ago to use that to treat you. They have to look at your condition that is at stake. If you have a headache, they are not going to say, oh, we studied how potato ends up in the stomach and treat you. They have to diagnose you according to what you are going through and whatever medical information is current. They are not going to use a 17th century therapy or treatment to treat modern issues. For instance, when it comes to COVID-19, what are the pathogenesis? How does it evolve? How did it come to be with us? How is it supposed to be treated? Are you going to go by the vaccination that was used 200 years ago, or there is a modern way of vaccination? So that's what they're going to go by. Pretty much in account, what it means is, so Dr. Nebeshawa, on kase obi or treating is be a yare bibi sana yare bi bo obi 10 years ago nti sa yare na board no ye de yam kakadro ne ye de son no na ne ho ton nti so de nam say bibi sa nti ye yam kakadro ne fan so there be as a sort of diagnose yes say do for machine mu MR bia say do for ma or do for no hwe say currently treatment where say ye de treat with problem and so use nti so use information a current and yet 20 years ago information you use so your current. Into doc, if I go over and you have any questions, let me know. The second point I want to raise is, it's your right to be informed of your health status, which includes.
Doc, excuse me. Let me just add something to what you just said.
Go ahead, sir.
Actually, what happens in addition to what you said is that so if I come to the hospital and I come with a particular disease, the doctor should be able to give me the exact and the precise place where my infection is.
Exactly.
He's supposed to know it. If he doesn't know it, he has to do all the laboratory issues to tell me that I have my infection is related to maybe my kidney or maybe my brother and other things. And then he should show me where my brother is and what the function of my brother is and why the brother is dysfunctioning. So if he gets to tell me that my brother is dysfunctioning, then it means that anything that is coming through my brother shows a sign. Then I have to admit that that thing that he told me is right before I will continue with it.
Thank you. That is awesome. Yeah. And like I said, they have to have an updated information for your medication. So knowledge is not actually static. Knowledge to me is evolving. It's dynamic. It keeps evolving. So whatever the medical doctors used 200 years ago, that's not the same they use now. There's been updated information that they have to use to be able to treat your malady, your sickness, or whatever it is. All right, so it's your right to be informed of your health status, which includes any diagnosis and prognosis. So what it means is that when you go to see your provider, they should be able to tell you exactly what is going on with you. Like Dr. Opoku Agyeman was making an example of bladder. If they diagnose you and they say, oh, you have a bladder infection, you have cancer, whatever, they shouldn't be scared of you to tell you what you are going through. I mean, oh, doc, then harm me. Mr. Enyo, Doc, Deben Hami, what is wrong with me? Mr. Antimin Enyo, they should be able to tell you exactly what is wrong with you. When they go to medical school, they have all this training. You have to be confident. You have to be able to look at your patient straight in the face and tell him or her, sister, you have cancer here. You are not the first person that has it. We can go, we have a way to treat you, we can help you. So they should be able to inform you of your status. Don't just go and say, oh, me and Tuminka, of course, if you're a minor under 18, then maybe they need your parental, consent to be able to divulge the information. But then if you go to see your provider, you are old enough, they should be able to tell you, hey, Jack, when in whatever it is, they should be able to inform you of your problem and what they can do, how they can go about it to bring you remedy.
And,
all right.
And again, the doctors are not magicians. They cannot know what is happening to you. But some of us who are the patients sometimes hide something. Sometimes when you have a pain, you may not tell the doctor. When you have some kind of something in you, you wouldn't like to disclose it to the doctor. If you don't disclose anything to the doctor, and then tell him precisely where something is hurting you, and you don't refer him to do the examination towards that particular place, it is most unlikely that he can give you a good diagnosis. And now we are here. We say, me yafun na me ya, but more than who we yafun baby ya we ano. Say the beya obetimi ahunu baby cry area no. Na wetima make appropriate diagnosis. Wetima treat you mun yentia ewo the fang the entia ma unhunu ne wunhunu no. And no na babu ama we are no yetima kuniye. Na sa wokọ na de bibia na sabi obema mu na ya we ya. Na obama mo so de nam say why ask na ya na untimi nka ho asem ntino no dia most unlikely say obama no yare na wo no obetima ya ho adura na ko.
Thank you, Dr. Agyeman. What they are for me nka hwe makama no atum. Anyway, I want to welcome my niece all the way from UK. Comfort is with us live on the show. Comfort, you are welcome. All right, so let's go in. I said tonight it's just Dr. Agyeman and myself just doing a live discussion on this topic we've titled The Rights and Responsibilities of a Patient. Of course, in a medical treatment, both parties are involved, the provider and the patient. You yourself, you have the right to refuse or to accept. So that's what we're discussing tonight in case you join us. And if you want to call in, it's 240-280-2633, or you can text just like my niece did, 510-931-0946. All right, another point we want to raise is to give, you have the right to give or withhold informed consent for any medical treatment. I said earlier on that if you go to see a provider and they want to do something for you, they diagnose you and this is what they want to do. Most often they want you to sign a consent form. There are some minor issues that, or if you go, they can just tell you, oh, go get a OTC on the counter, medication or something, just go buy Tylenol or something, you'll be fine. But there are some issues that if they have to do surgery or some serious therapy or something, they would request your consent. What it means is that you are telling them, doctor, you've told me what my problem is and I consent, because most often when the doctors give you a diagnosis or a prognosis or whatever it is, they look at your welfare above their own personal issues. They look at the advantages and the disadvantages. All right, if we withhold this treatment from you, what is going to happen? Of course, for every treatment or most of the what we go through, there are risks here and there. But then they weigh the risk and they weigh the advantage. If the advantage is more than the disadvantage, the risk, then they go ahead and do it. But if the disadvantage or the pain is going to be more than what you're going to experience, then they decide not to do it. So you have the right to say, doc, you've told me what I need, but I want to reject. There is no harm or no sin in rejecting. Of course, without any one of these, there are some repercussions that you may go through. But then if you think what they want you to do is not what you want to do, then you can say, okay, I'm not going to sign a consent form. I don't want to do it now. I can wait. You can seek other opinions. It doesn't mean that when you go and your doctor tells you, okay, I am going to amputate your right leg, and then straight away you say, if you are like Abedipele son, are you, if you are Samoajan or whatever, and your right or your leg foot is what you use to score goal, and they say, hey, you have to decide whether you want to do it or you don't want to do it. So you have the right to sign or not to sign for any procedure. And like I said earlier on, for every procedure, there could be risks here and there. if you decline it, it could be something that will come and bite you another day or something, but then you have the right to say yes or no. Doc, do you want to add anything to that?
Yeah, you don't have to forget the consent form also carries every pros and cons of what you are going to do. The doctor will explain everything to you. He wants you to know the precautions that is going to happen and the remedies in there. So as soon as you do not object to anything and you sign it, it's definitely anything that comes after it, you are responsible for it. The doctors are not all that responsible for all of them. So that is very important to understand the consent before you sign it. There was something that we nearly jumped over it. There's something we call pain.
Okay.
Pain is something that is well known by the person who is suffering it. Pain has a lot of characteristics. It can be dull, it can be sharp, it can be mild, it can be or any other thing. So if somebody or if a health practitioner is asking you about your pain, you should be able to describe the pain very well. You should be able to know the strength of the pain and the duration of the pain and the way the pain is, whether it's continuous or intermittent. You have to know all these characteristics in order to give a very precise information to your caregiver. So your caregiver will know exactly what he's going to do to you. Don't say, I have a pain. If you say you have a pain, it is really vague. Pain is not something that you can say, I have a pain, and that's all. You really have to know what kind of pain, how the pain is, how long can the pain continue in where the pain is, or is it going up and down, or it's not? Is it a knife light? Is it a pin, or what we call the pin type, or is a door, or is a numb? Don't forget that numb is also a pain. It's only that you don't feel anything; the whole body becomes numb. It's also a type of a pain. So you need to describe everything in detail so that the one who is taking care of you would be able to identify your pain and then find the appropriate treatment for it.
All right, moving on. We have a question from Comfort all the way from UK. Comfort says, would you advise people to recheck with other hospitals concerning the sickness they are telling you, or you have just to be sure, seeing there are cases that people get wrong reports? Definitely. I mean, it's like healthcare can also be like shopping around. Of course, when you go to Walmart to go and buy, let me use a hypothetical example, like a dress. You know, you've seen a particular dress that you're so interested in. You've seen it here, and you've seen it also in Masha. You go and look at the price. Okay, the same texture, but then the price here is cheaper here. You can shop around. And when it comes to healthcare, of course, with insurance and all that, you've been assigned your personal provider, who is the immediate person you have to go to. Or let's say if you go and your provider is proposing some kind of remedy or treatment, it doesn't hurt to ask another doctor friend or somebody, oh, this is what they are seeing. That is why even when they do the MRI or they do scan or whatever, maybe you go to Kolebu and they scan, they might not see anything there. You go to a private clinic like in Yahoo or somewhere, and they will see it. Or sometimes the private hospital cannot be able to identify what is going. They'll tell you to go to a bigger hospital. So Comfort, I don't think it has to shop around and be sure that what they are seeing the same thing. Of course, I think there was one instance. Let me use the story about Kennedy Agyeman, one of our Ghana MPs. He said he started with a Ghana hospital where he had fallen. I think he fell, and you know, Ghana, they use superstition to everything. They thought somebody has voodoo him or something. But he said he went to the hospital and they did a scan. They saw, I don't remember, there was something like a tumor or something in his brain or something. And so they had to fly him outside. Arguably, they couldn't treat him there. So he came to the US. And the doctor also scanned him, and he saw the same thing. So in this case, Agyeman was actually praising the Ghana doctors. That, wow, you guys were able to say this scan before I came here. So, you know, seeing that thing in Ghana, if he wasn't sure and he came to US and they also showed the same, which means what, it's been confirmed. But then if he came to the US and he didn't see it, then they could say, okay, either the instrument they used in Ghana was either too sensitive or they caused something else. So Comfort, it is not wrong to, you know, ask other doctors about your situation. I mean, they can have advice. Doc, you want to ask something?
Yeah, it's very, very important to have at least 2 or 3 people to diagnose exact thing that you are looking for from your PCP. It is not what the confirmation is not from one person. Medically, anything can happen to where they have the maybe if it is X-ray or MRI, something might have happened there a few days or 3 days ago, and then the whole body will change, the system will change. So when you go to another place, they can have the same picture and have nothing there. So you need to do it in about three particular places in order to be sure that what my physician told me is right. Other than that, don't follow one person and go and hurt yourself. Something has happened before. I think if I remember in some of the literatures that I've been reading, there were some people who were taking some medications, and for some reason, that medication was causing a kind of deformity. Until they found about 4 or 5 people of that was the time that that medication was withdrawn from the market. I don't want to disclose the country's name, but something happened like that somewhere. So anything that you see, first, confirm it from the next or the third person. If they all tell you the same thing, then you have to know that it's very important. You have to go ahead and find resolution for that.
All right, thank you. So, Comfort, I think our response helps with your question. All right, so staying on the aspect of consent, apart from the electronic or the the paper you have to sign, again, there's the issue where when you go for some treatment, of course, we have students, interns, all these students coming to study, and they bring them to the lab or theater, wherever, for them to understudy. And so there is an issue where the doctor might want your particular situation or medical issue to be photographed, to be scanned, images made of them as a teaching tool, and normally with the hospitals or bigger institutions, when they have student interns or whatever coming to understudy and they make images, they are all kept confidential. But these days, you never know who you are seeing. So a doctor may decide, madam, want to take a photo image scan of what, or your tumor, whatever it is. As far as consent is consent is consent. Okay, I think that is poetic. As far as consent is consent, you can still say no. Okay, I don't want a picture of me taken. Let me use example like maybe breast. Okay, breast. Women are very sensitive about their breast. You go to see your doctor and he says, okay, after mammogram, they see this tumor, whatever it is, and they want to take pictures and all that. That is being done for the medical purpose to make sure they are treating you well. But if you realize that this doctor is shady and they want to take the pictures for something else, you have the right to say no. No, I don't want any pictures taken of me. We don't know whether it's going to end up on Facebook or YouTube, so I'm just saying. But then if you're not comfortable and you don't want any pictures or any scans taken about you for the purposes of, just because they want to take it for a treatment, that is fine. But if it's any other ulterior motive and you don't feel comfortable they taking picture, you can tell the doctor, all I want is my treatment. I don't want these pictures taken for any other reasons. Some of them do it for research purposes. You don't know where it's going to end up. Of course, the researchers help for other people to benefit from. But if you don't feel comfortable about pictures being taken of you, you can also decline the consent on that. Doc, any take on that?
Yeah, I think that area is very important in 2 ways: the patient and what kind of instrument that they are going to use for the for taking that picture. I would probably advise all patients that they should ask whosoever is telling them to go for anything to explain what benefit is that machine that they are going to use would help her or to help him. And then in some cases, your name will not even appear on the form.
The images, okay, that's true.
Your index.
Okay.
They use your index there in order not to disclose your identity. So for that reason, you can allow them to do it. But remember, if you are going for MRI or you go to CT scan, you have to ask them, what are the benefits of the CT scan and what are the non-benefits of the CT scan? And is it going to help me? If it's going to help me, how long? You have all the questions to ask. Just ask them to be clear with what you're going to do before you go in. Don't go in first and come back and ask questions, because that one is over. And then I think in some cases they allow you to sign a consent form. In most cases, in the diagnosis room, they won't let you. You have been go and do your scan and come back. Again, why do you have to go for the scan? That's the question. The why and why should always come into your mouth when you are in the hospital or whenever any PCP is attending to you.
All right, thank you, sir. So pretty much we are all beneficiaries of what somebody went through. So if a patient 10, 20 years ago had a particular issue where, images were taken as far as the names did not appear to identify them, and they were able to use them as research, because of course, cancer is just, growth of cells. And so if they took a picture of somebody's cells or growth, as far as your name doesn't appear anywhere, it's all discreet and it's all sensitive and confidential. That can be used to treat further or future events. That is how we get treatment for all that is gone on over the years. The cancers that we've seen over the years were used as a study, as research, to provide therapy for us. So sometimes, like I said, if the doctor is not going to put your name there, it's not going to show anywhere, but then just the image which can be used for research for solutions to come, it's appropriate. So just make sure you ask the doctor, hey, as far as it is confidential, my name is not showing, just the pictures which will help other people, that is fine. So thanks for that addition. And let me try to ask a question that Sister Abner is asking here, First Lady. Does a patient have a right to be informed if there was a wrong diagnosis or wrong medication administration? Definitely. Doctors swear this oath they call the hypothetical oath, hypocritical oath. What it means is that they will only alleviate your pain. They will make sure they take pain from you and not increase your pain. So whatever they are doing to you is for your well-being. And of course, we are all human beings. Every now and then, some doctors might get it wrong. There's been instances, of course, you and I have heard it, where a patient goes to a surgical theater and he's supposed to have his right arm amputated or right leg. For some reason, it so happens that either the doctor is facing the patient and the doctor's right is the patient's left, something happens. So instead of the right arm, the patient ended up having the left one amputated, which is a medical error. So they always have two or three people to verify and make sure what is in your medical record is written that Jimmy Jones will have their right ear taken off, not the left ear, and somebody has to, see to it. And then when doctors go wrong, when they make a wrong diagnosis, that is not the end of the world. Of course, in medicine, you cannot make some of these mistakes, So if a doctor makes a wrong diagnosis, as long as you have not been treated with a wrong medication or something, they need to let the patient, they are supposed to, otherwise they get fired. Hey, if I give you this diagnosis and it's a wrong one, you go to sleep in the night, midnight, your soul spirit tells you, man, I gave a wrong diagnosis to this patient. You have to get things right. You have to either notify the patient, notify the patient's immediate provider, let them know that, hey, you made a wrong diagnosis before they cut the wrong thing. So if I come to you and my kidney is hurting and you tell me it's my lung, that's a wrong diagnosis. So you want to make sure you admit whatever you can do to remedy it before it's too late. That is very important. You want to make sure the right thing is writing or made down before it goes wrong, because you don't want to have your patient come to you, give the wrong diagnosis, you don't correct it, and eventually it is too late. Oh, Mr. Jones was supposed to have his right ear taken. Unfortunately, they took the left one. That's really bad. So if you make a mistake, admit it, go to the channel, whether it's your medical chain of command or whatever it is, whatever you can do to make it right before the patient loses that aspect of their body, you'll be doing the right thing. Because I will applaud you for seeing your mistake and letting me know than waiting for it to be done and come and tell me sorry. I mean, we say sorry all the time, but sorry in itself doesn't treat anything. Doc, your take.
It's very important to remember what this lady asked. Should they tell you if they gave you wrong medication?
Or diagnosis.
Wrong diagnosis. It takes, actually, if it is identified immediately, that is the best. But when it takes a longer time, then it's another thing. It appears every team has a team of surgery or whatever. They have their team leader. And I think they are more cautious when they are doing something. But when you're talking about medication, it's very important to look at it from the perspective of who is giving that medication. If somebody gives you a wrong medication and you have not swallowed it, or you have not taken it, perfect. Don't take it. Just come back to them and say, I think this is not a medication I requested. But if you have taken it and at a certain point in time you realize, or somebody identified the medication and said, oh, this is not the medication that you were supposed to take, please take it back to them, ask them, and then for all other consequences that is related to that medication, they are responsible for it. So yeah, I will stop here.
All right, thank you, sir. Well, you are still listening to Era One Radio. We are broadcasting live on Facebook and YouTube and Modern Ghana Radio. Since we're talking about health, we want to applaud the services of one of the hospitals in Ghana, which is doing a good job, making sure they are following patients' rights, and they're also telling their patients what their responsibilities. Let's listen to Agyeman Hospital in Ghana.
Hello, beautiful people of Ghana. This is Banahine Specialist Hospital. We are so excited to announce to our people Ghana that we are finally opened and we are accepting patients. At Banahine Specialist Hospital, our extraordinary physicians and nurses are here to provide a high quality medical service to our extraordinary patients. Our services include primary care services, maternal, neonatal, and pediatric services. We also have an in-house pharmacy. We have x-ray and laboratory services available to you. Come to us for all your healthcare needs and you will be happy you did because we believe the health is wealth. Thank you and stay blessed.
Alrighty, welcome back to Era One, broadcasting live on Facebook and YouTube. This is a 24/7 program, and you can always chime in and listen to the interesting music and programs going on. All right, we are rolling still on the rights and responsibilities of a patient, which all of us are. We are at any point a patient of something. So we're looking at the rights. Now let's go on to another right. Your other right is to receive reasonable continuity of care. What that basically means is that, okay, you've gone to see your provider in a treatment and they've given you this diagnosis. They tell you, oh, ma'am, brother, sister, maybe you have cancer or so and so, you have this issue or whatever. They will prescribe a type of treatment for you, okay? And maybe that might just be a stop at a point. But then beyond that, the doctor can say, okay, this prescription I'm giving you might not even solve the problem itself. You need a continuous, care, which could be chemotherapy. Let's say if you have cancer, those chemotherapy can kill the cells and all that. So you say to yourself, oh, I've heard that chemo makes some people lose their hair and all that stuff. So you don't want it. That is another thing. But then if your doctor tells you you have cancer and that there are other things they can do for you, please go ahead with that. Make sure you are going with any continuity of care that you deserve. The doctor can't tell you, okay, you have cancer. I will give you this medication. Go and take it 3 times a day. If the medication is run out, that's it. You deserve or you have the right to receive whatever care that goes with the diagnosis. So if they say you have cancer and you research or they tell you, okay, we have other treatment we can give you, but because your insurance doesn't or would not pay, so that is we are done with you. No, you have the right to receive continuity of care. So whatever you can do to make sure you're having all the the trend of treatment that you deserve it. So discuss with your doctor. You told me I have this. What other options do I have? What is the last treatment I can go with this? What is it that is going to resolve my issue? Don't limit yourself to, oh, you were diagnosed with this, end it there. You have to go beyond and get all the care that you deserve. Another thing is to know who is treating you and their professional status or qualification. I'll make Dr. Opoku Agyeman respond to the first one when I finish this. All right, so you have the right to ask your doctor what qualifications they have. It's weird. It's weird that you see, let's say, a mechanic or maybe a taxi driver coming to the hospital to say, hey, ma'am, today I'll be the one doing your surgery. You don't know this. He doesn't have a badge showing that, oh, I'm the surgical operator, so and so. You have the right to know who is going to operate on you. I mean, if you are scared of asking, ask the nurse, who is this person? Is he a doctor? You can research them. How many surgeries has he or she conducted? Has it been successful? You can find out. It's your right. It's your body. Because if it's messed up, that's all you have. So you have the right to ask all this. Don't say, oh, maybe I'm a ferry, maybe could be said, because I mean, you too know. Find out. And most of the doctors are so professional. They come in and say, oh, I am Dr. Charles Boy, so and so. I've been doing this for, even before the surgery, you have the opportunity to talk to them and find out, who they are and their expertise, their experience. So you're not going to have a pilot come to, operate on your kidneys. In the same way, when you board a plane and you have a medical doctor sitting in the cockpit and say, oh, on the airwaves, I'm a medical doctor. This is my first flight. I am testing to whether I can switch from being a medical doctor to a pilot. Are you going to be comfortable seeing a doctor coming to pilot the plane when he hasn't had the experience? So in the same way, you want to make sure the person who's going to operate on you, you know the person. Of course, before the surgical operation, you would have known the doctors and all that procedure before even entrust your care into their hand. Doc, any addition?
Yeah, in addition to what Dr. Boison is saying, it's like what we have previously said. If you're identified with cancer, yes, who identified you with the cancer? You see your PCP? Is the PCP a specialist, a cancer specialist? No, you have to, ask all those questions in order to get a referral. There are certain doctors who do not like to refer cases. This is very important. Back at home, I know that if you are sick in a rural community, they would give you all that they want to give you, but that is not it. It is something that right now there are so many different doctors with expertise. So I would strongly appeal to all those doctors who want to do everything by themselves to look at the expertise and let them do the work so that people's life will be taken care of. I think there was something that Dr. Boison was saying about qualifications. If in most of the advanced countries, in the PCP office, you have to put your certificate by the wall for the people to see it. So when you go to the hospital, the first thing to do is to see at the back of where the doctor or whoever is doing that work is sitting and see all the qualifications that she or he has before you can even go ahead and discuss something that you want to discuss with him. If not that, if you go and the back there is blank and he's sitting there, you don't assume that the person has something. Otherwise, he will tell you something that you don't deserve and you go into it and find yourself in trouble. Unless otherwise, that is not permitted in that country. But I think in each country, that thing is there. You have to have your certification at the back of you. And if you have recertified for that year that you are practicing, so you don't go and do something with somebody who has not been certified and then he's still practicing.
Thank you, sir. All right, we are a little bit behind time. It's 4. Oh, well, my here is it's 4:40, which is 6:43. We are 17 minutes into the end of our program. So what I'm going to do, I'm just going to quickly, run through the points, and then we'll run to the responsibility, because we want to make sure we are tackling both of our topics. That is the rights and the responsibility. We don't want to leave the other one. So you also want to know who is, okay, that's the point I just mentioned. You have the right to participate in decisions about your care, treatment, and services. You don't leave everything to the doctor. This is what we want to do. This is how it has to be done. You have to participate, because they give you medication and they tell you, take this twice a day, maybe one in the morning, one in the evening. Don't say, oh, me too, you wait and take all the 2 in the night, or you take 2 in the morning and that's it. They have a reason why they want you to take 1 in the morning and 1 in the evening. There is always something behind something. There is a principle, there is a philosophy, whatever it is behind whatever they tell you. So if the doctor says, I want you to do this, you have to cooperate. If you do not understand why they are giving that instructions, ask before you come home. Don't come and assume. Do not assume. So make sure you are taking part in your own treatment. Of course, the doctor went to school to be able to treat you based on experiences from textbook and from practical experiences. So whatever they have learned, that's what they're going to tell you. Sometimes they might get it wrong. It doesn't mean they are not professional, but then they will do all they can to help you. So you also have to cooperate with them to take your medications their way, because if you didn't have faith in them to go to the hospital, then if they tell you to do something, don't say, oh, I have faith to come in, but then if you give me medication, I'm not going to take it. All right.
Doc, let me ask you a question before we go on, because this is something that happens back at home.
Okay.
Now the doctor is sitting at the one corner, the pharmacy is sitting at the one corner, and the dispensary is sitting at the one corner. So before the patient go to sit at the wall there waiting for their medications, then the dispensary will come and go. Mami Fuya come, then Mami Fuya will go there. What do you okay, no afraid the. So what kind of cooperation or contribution is the patient making towards this kind of treatment?
All right. So in this case, well, sometimes when the doctors first, the prescription has to come from the doctor.
Yeah.
The pharmacists don't prescribe it. It's the doctor who prescribes. Of course, sometimes you can't even read their handwriting, which is another thing. So they scribble their hand. Of course, they have to discuss with you even before you leave their office or something. Okay, like some America, you're in a hospital and a drone and person make sure my intimate sure say your mouth pharmacy. A drone, your friend is say, na be person of fan beer and a pabaku and breba kuncho be ma hint to the office or answer wako. And when you get to the pharmacy too, they also have to issue the medication, and the good ones, of course, that is what they are trained to do. They don't assume that, okay, you understand English, so they just, sometimes they will tell you, okay, this is your medication, take one in the morning, one in the evening. These are any, side effects. They didn't even go to explain to you, but if they don't want to scare you, they will skip the side effect aspect, because they know, say, Drobia was side effect occurrence. But then it is their responsibility to tell you, this is what your doctor wrote for you. And me as a pharmacist, I've also studied some of the things that the doctor has studied. So the doctor says you should take this medication. This is the name. You have to take it 2 times a day or whatever. Ma'am, sir, do you have any questions? Don't let them rush you. Of course, there might be 100 people waiting in the pharmacy, but you are unique. See yourself as unique. You have the right to be explained to what the doctor wrote for you or what the pharmacist is giving you. And there's been instances where a pharmacist could give anti-MS medicine to Kwabna Papa. So you want to make sure before you leave, read the name on the bottle. Is that your name? Make sure your parameters are correct. Your name, they don't put social, but then some parameters that you want to make sure it is you. If you have any questions, please ask before you. Don't let them rush you and out. So I think that point is clear. Am I right?
That one also, I think there's something that we have skipped it. Let me just bring it in here. That one also go to the laboratories. If you go to laboratory, make sure that your specimen is you, not anybody but you. If you go to the laboratory for blood smear, make sure that the blood smear is you, but nobody's name but you. So those are the tiny things that they need to understand it in order not to go there and then they use Kwasi's large specimen for Adjoa's large specimen. Then it brings some kind of different diagnosis in terms of prescription of medications.
Exactly. I mean, can you imagine you presented your lab specimen, let's say urine, and they have Kojo Mensah's name on the label eventually. If Kojo Mensah has blood in the urine or white cells in the urine, whatever, the doctor goes by the results and gives you medication. Right. Can you imagine the doctor giving you medication for something you don't even deserve?
Right.
That is wrong. Or can you imagine, okay, they test your COVID sample. Maybe there was a mistake somewhere and they tell you your COVID results is positive when you are negative. Doctor says, okay, oh, yes, so when you're positive, I'm going to put you on, what is the medication? Remedy or whatever. Whatever medication.
Not even that, they isolate you and quarantine you.
Exactly, which when you are supposed to attend some party, now they've quarantined you for 2 weeks and you missed that party, all because somebody gave you a positive result when you are negative. Anyway, thank you, Doc. All right, so you also have the right to designate someone to make decisions about your care if you cannot make decisions about your care, treatment, and services. What it means that maybe, okay, you are going to be involved in an accident or something or anything, and at that time, you might not be able to make decisions. For instance, you are involved in, God forbid, accident or something. They need to do a resuscitation, whatever. You cannot speak. You should have a family member who can be called in, say, oh, Adjoa, Abna, Kwesi, Papa, whatever it is, your brother, sister, you cannot speak. What do you think we should do for the person? You should be able to designate somebody. They have, all kinds of forms you have to fill, even when you go to hospital for major operations. They make you fill all those forms that in case of anything happens, in case you are incapacitated, you cannot speak or talk, who do you want us to consult to make these decisions for you? That is all there. So you have to be able to, you have the right to list down so and so, oh, I want Abna from Proma to give me, to authorize that this should be done to my body, so and so in case of anything. All right, Comfort says, please let the doctors write out what we can't also read. That one, yeah, I don't know whether I have control over that. She said the doctor should write legibly for them to read. I guess because they see a lot of patients, they're always in a hurry, they scribble. Of course, you are right. I wish they would write slowly for us to see, but then it is them and the pharmacists who understand their signature. So if I
think that is why they have
electronic
transcribers.
Okay.
Some transcribers who learn the way they write. So
well, I mean, she's talking about the patient being able to
understand. The patient can ask the transcribers what it means. So I think that one is. But Doc, let me just ask. In addition to what you just said about how they should write what they want, who should represent them when they cannot do anything. Okay. In addition, you can also write DNR. Do not. Okay. You don't want. I don't want. If you do anything, I'm not surviving. Please don't worry me. Let me die. Okay. You can also specify it on that too.
That is true. All right, we have 9 minutes more, but then the studio clock says 10 minutes more. Okay, let's go. You also, as a patient, has the right to receive confidentiality, privacy, and security. If you go to your doctor's office and they're going to do a mammogram or something and the curtain is wide open, other patients are walking through, you have the right to tell the doctor, hey, maybe I'm a ferry on pacho before I obey you need confidentiality, you need privacy. And the doctors, they've also sworn that when you go see them, they are not going to broadcast your disease, your diagnosis to part of the world. This is a profession that when you go in, you have to swear that I'm not going to be telling people's problems on Facebook or YouTube. Oh, you see that guy going, they cannot do it. You deserve or you have the right of confidentiality and security. And you also can accept or decline the involvement of students in your treatment. Sometimes, like I said earlier on, the hospitals might bring interns to come in and study them and observe what they are doing. If you don't feel comfortable, you can tell the doctor, hey, I don't feel comfortable with the student hanging around and looking at what they are doing, especially sometimes, when women go and there are certain parts of their body that they don't want other students or men to see. So, okay, so doctor, ISS and my students, you have that right as well. And then you also can use pastoral or other services. Hospital, before I me diagnose and I said, you can do that. Maybe you are going through cancer and it's intensifying. So, I want to bring in my doctor, my pastor to help me absorb this information. You have the right to take in your pastor to, whatever advice they can give before you go. And also, like Dr. Agyeman said, you can have an interpreter. If you go to the doctor, maybe you think they're going to speak big English or Spanish, something you don't understand. You can, if you are Spanish, you don't understand English, take an English interpreter and say, oh, what did the doctor say? Oh, the doctor said, oh, amigo, so and so, you understand. All right. We are out of time. Doc, do you want to say something quickly before I move on to responsibility?
Let me just say two things here. Okay. First thing is, the interpretation is very important. English is English. If you don't understand the English, don't go to the hospital there and anything that it says yes, 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 yes. If you do yes, 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 you'll be in trouble. Exactly. The next one is the confidentiality, privacy, and security. It's not a fact that your body is exposed alone. All the information that they are taking from you, even from the computer point of view, you don't want people to be reading it. So your folder and your anything on the computer must be private. The person who is taking care of you is the only person who is responsible for it. Nobody else. It's the team that is responsible. Any other team member cannot come there and read your own. If the person does that, you have the whole right to be responsible to that person.
That is what they brought in, what they call the HIPAA. I mean, HIPAA, you can always Google HIPAA and find out what HIPAA is. HIPAA. That's the Healthcare Portability Act and all that stuff. You want to make sure your information is protected. That is why when you go to hospitals, people don't put paper information in the trash or dustbin. Everything that has patient information has to be what? What is it?
Privately disposed.
It has to be shredded very well so that you don't see any information, especially social security number and all that. There are some institutions that go about selling social security numbers to other companies. That is wrong. HIPAA forbids that. So all information is kept privately, just like you said. All right. So if you look at the rights of the patient, you have all this right. Let's look at the responsibilities. Patient, you have your your rights. This is what you deserve. The doctors have to treat you this way or, what you need to do. But then you as a patient, you also have a responsibilities. For instance, if you go to the doctor and it gives you, based on a diagnosis, it gives you this medication, and you put it under your pillow, thinking that, oh, the medication is going to go through osmosis or division into your body to treat you, you are defeating yourself. You are deceiving yourself. Doctor say, Mommy, take this once a day or twice a day. Please work with the doctor. Be responsible. Let me read what the Code of Medical Ethics Opinion 1.1.4 says. It says, successful medical care requires ongoing collaboration between patients and physicians. Their partnership requires both individuals to take an active role in the healing process. So you subjected yourself to a doctor to find a treatment for you. And so whatever he tells you by faith, take it and you shall be well. All right, so as your responsibility, you have to keep your appointments for health treatment. If the doctor says, I want to see you at 10 o'clock, don't say, oh, maybe I'll eat my fufu and take my time and get at 12 o'clock. You have to keep your appointment because they have so many people they are looking at. You have to keep your appointment and make sure you are receiving your care. To follow instructions given to you about self-care and medication is very important. We cannot overstress that. If you have the faith to go see your doctor, if he prescribes medication to you based on his knowledge and experience, please don't argue. Of course, if you have problems or questions, ask. But then if you are going to believe him to give the diagnosis, but you don't want to take the remedy, you are not helping yourself. And you have to ask questions. This one, we cannot underscore it or overemphasize it. Please, you have to ask questions. If whatever they are telling you, it doesn't sync with your spirit, mind, and soul, ask questions before you leave. Don't leave the place before you go and ask questions. Sometimes the nurses will not even allow you to go back. You have to call for another appointment. So make sure all your questions are answered before you leave. Don't make any assumptions. If they write something you don't understand, make sure. Sometimes you can even ask the doctor, Doc, a drop and actual mommy. Okay, make sure acetaminophen, you know, whatever it is. Into Okona pharmacists, no, my way to first. Oh, make us a doctor, make us a bet you, mommy. No, yeah. Oh, I'm poor. I'm saying wrong medication with them out. You are helping yourself. All right. You have the responsibility to give complete and accurate information about your present health concern or past illnesses, hospitalization, medications, and other matters related to your health. The doctors are not magicians. When they go, they do a historic scan of you. They ask you, has your father had it before? Is this sickness in your family? Don't lie. So why wouldn't him say, oh, Papa, OD 20, OD 30, OD 40, don't be scared. There is something what we call genetics or hereditary. Tell the doctor, so, oh, I think, say, they can go through your genetic roots and be able to help them. Although they've studied, they are not doing trial and error, but then that will help them to be able to diagnose your problem very well. Because if you have obesity in your family, it's possible that that genes could be transferred to you. So, oh, my mom died as an obese person. Let the doctors know. So it's your responsibility to give the right information. If they ask your age, don't lie. If you are 72, don't say you are 42. And vice versa. I know of a guy who came to this country, or in the age is 10 years. In the time they do say I saw retire, according to the age of papers, no do yet. Until now, where the 70 years old retirement, but no what to age. So don't lie on your your forms and all that, please. Take responsibility for self-management activities related to your healthcare. Please, we cannot overemphasize that. Take care of yourself. Make sure you are working with your doctors. And then to meet financial commitments for services provided that are not covered by insurance. Please, please honor and pay. It's going to affect your credit score. It's going to mess up your score. So we don't have too much time. Doc,
okay, the don't forget, sir, doctors have time for one patient, a minimum of 15 minutes and a maximum of 30 minutes. And please don't buy medication from anywhere and start taking it if you have anything that is affecting you. Don't think that all medication can heal any other thing. And then don't forget, as Dr. Boison just said, don't forget to hide any of your old sickness history. It's very important. It helps for good diagnosis. And then take care of yourself. Take care of yourself. You are yourself. Nobody can come to you and know what is in you. So you have to talk about yourself for somebody else to know how you are feeling in yourself. And finally, there are certain that happens to us. Some of us who cannot explore the medical system. If you cannot explore the medical system and know what is in there, please ask somebody to help you. Your children are here who have gone to school or back at home. You have now literally children have gone through the computer system. Let them help you to know, to explore the medical system. so that you can actually enjoy it well. Don't go halfway and then you hear something and you follow it and go to the wrong way. Let me give you one typical example about somebody who died in Ghana a few days ago. The person bought some medicine from outside, and the medicine, those guys, that quack people who have been selling the medicine in Ghana, they added almost all kind of capsules and added some herbs to it. And then they asked this man to drink a cup 3 times a day. You can imagine how many capsules that was in the bottle. The man drank three times of it, and at the end of the 3rd time, he died.
Oh, wow.
So I want everybody to be aware that taking care of yourself does not necessarily mean that you have to wash yourself or put on good clothing. Your medical and your physical strength is very important. Thank you.
That's a very good point, because but in you might think that, could you call the doctor or send it and the man paracetamol. Also, interrelated with other things, heart problems, or others. So don't just assume. Paracetamol for also don't assume. Please take care of yourself very well. I always say that you have only one body, and when that is messed up, that is, you are done. Your soul and your spirit, they will leave and go back to wherever they came from. So take care of this one body. When it's done, it is done. I want to thank my niece Comfort all the way from UK, join our sister Abna from Poland, and all those who watch us this evening. I say thank you. Go back to YouTube and Facebook and watch. Please share with your friends and relatives. Subscribe to Era One Radio and listen to all the programs throughout the day. This is a 24/7 program, 24/7 from sunrise to sunset. There's always it's a production, be a conversation, be and there's always music that will suit your body. Thank you very much, Dr. Opoku Agyeman, for being my co-host this evening. I know you were in the program, you had to jump in this evening. Thank you, Era One. Thank you, Dr. Ostus, for making this platform worth using. Continue increasing, and please share this link with people. Go to your Play Store and download this app, the Era One Radio. You will always be notified when we are on live. Comfort says, thank you, great lessons. Thank you, Comfort, again for being our guest tonight. Doc, it's a pleasure having you tonight.
Bye-bye.
We'll meet you again next week, and let me give you our favorite in common kitten art, and then we'll be gone.
They are 4 women. They are beautiful with brains. They are eloquent, decent, wise, and experienced. You have heard many, the funny. Now, it's time to hear the experience and the brainy. Meet Selena, Dorcas, Gifty, and Annette as they present the real in common kitten. In common biaye sesi chin, the dead, as in takrenu assume the dead, the real in common kitten. Showing live this and every Sunday, 7 p.m. on Era One Radio on Facebook and on YouTube, Era One Radio and our Taibo channel. Kaise, so we see the real in common kitten what brabon tete, we nyan konkonsa, we the real in common kitten.
Aden urefiana se otumi manya eni about Aden wasu mani su afosunya day Aden meba Aden kra ya useni da swasa eni da sonsa kra eni da sonsa yo eni da sonsa ya mensubi eni da sonsa eni da oh, I do.